morning everyone. Just wanted to post a little video today. I'm on my way up to Mossman, which I normally do once a month. Gonna help some people manage their diabetes and hopefully get their health back on track so that they live a long and healthy life. But the thing I wanted to talk about today was actually diabetes prevention. It's a very serious conversation, and a lot of people don't quite understand the ramifications of developing type 2 diabetes. They think that maybe they're not going to get it because they're not overweight, or they think they eat a healthy diet and they think they get enough exercise. But it's not just about what you look like on the outside. It's the actual internal health that is the most important. I'm not sure if you guys have ever heard of anything called TOFI, and that stands for thin on the outside but fat on the inside. And that means that you've got fat around your organs, and that is from eating an unhealthy diet and not getting enough exercise. And this is the actual biggest risk of developing type 2 diabetes. So I think it's really important that even if you think you're not at risk of developing type 2 diabetes, that you should do your utmost to make sure that your internal health reflects your external health. If you look healthy on the outside, you need to make sure that you are actually healthy on the inside. So that does require effort. You need to be making sure you are getting tested at least on a yearly basis for being tested for diabetes, making sure you get your bloods done to check your cholesterol level and your triglyceride level, and making sure your thyroid is working properly, and all those other things that people think, oh, you know, I'm healthy, I don't need to have those blood tests done. It is really important that you do have those done at least every year. A lot of people don't like to go to their GP because they think if they go to their GP, they're sick. Well, no, it's about being proactive about your health and preventing getting chronic diseases. So having those tests is really important. Now, the way that you can also help your internal health is making sure that your diet is packed with nutritious, dense foods. So, you know, we all think that we eat a healthy diet, but sometimes our nutrition is lacking in many, many areas. So if you think that you might be lacking in some kind of area, then, you know, talk to someone about it. Find out what kind of diet you're eating. See a dietitian, or if you think you're at risk of developing type 2 diabetes, have a chat to your GP, get a referral to a diabetes educator, and, you know, have your risk assessed. Because what we want to do in the long run is we want to make sure that this epidemic of diabetes doesn't continue. And it needs to start today. It needs to start with not only the adults of today, but you need to be looking after your children. Get them assessed. Get them to have their blood tests, and make them eat a healthy diet. Every year, people get diagnosed with diabetes. 280 people a day are being diagnosed, and that's just so preventable, and it's just so scary. So just have a think about what you can do to reduce your risks and prevent yourself getting diabetes. Have a great day, everyone.